Okay, what kind of things do you think women should be doing to look after their health and make sure they stay healthy for the future?
So I think having a good awareness on lifestyle, having a healthy lifestyle is important. So not drinking too much alcohol, not smoking or vaping, exercising, having that healthy diet, all the kind of lifestyle healthy things that we've been talking about are vitally important. And having awareness of perhaps when things aren't quite right, when you notice something might be wrong. So perhaps doing a monthly breast check, just to make sure everything is okay, and then knowing that where to go and get advice and to get timely advice should they find any concerns with their breasts, any lumps, or if anything looks different. And that's really important. And obviously having regular cervical screening and checking for HPV as well. Yeah,
I think that's really important, because actually a lot of women, I think, are reluctant to come forward for cervical screening, but it's so important. We talk about cervical cancer. If it's caught early, it's very, very treatable.
Absolutely.
And obviously a bit of a disaster if it's caught late.
Yes. Yeah.
There are some issues specifically health-wise around sort of menopausal age and post-menopause. What kind of things should women be thinking about?
Yeah, so the long-term impact of the menopause as we lose the estrogen in our bloodstream is the effect it has on bone density and also heart health.
Yeah.
So maintaining an active lifestyle, taking vitamin D, because that helps with the absorption of calcium, is vitally important. Getting out in the sunshine so that you can keep your vitamin D levels up. And looking after your cardiovascular health. So again, not smoking, not drinking too much, not taking any recreational drugs, ideally not being overweight if possible, and being more active, moving, getting out and doing things that are all going to look after your cardiac health. And then there are a range of blood tests that you can do that we offer at One Day Test to help monitor for both cardiac health and also just checking that your vitamin D levels are okay, so that you know that you're absorbing your calcium in the right way.
Yeah, and I think the cardiovascular conversation for women is also really important.
It is.
We think about it a lot with men. Men are a bit higher risk of cardiovascular disease, but equally women are. Yeah, women have heart attacks and strokes as well, and so should also be interested in checking their cholesterol, their blood pressure, their blood sugar levels.
Absolutely,
and addressing
because
all those things.
Your risk as a woman on your cardiovascular health increases at the menopause. So it's important to be really aware of that.
So would you say that might be a good point in a woman's life to actually start looking at all of those risk factors as well and thinking more broadly about their health?
I think it's a very good time, but I think also being younger and having that awareness as well, and taking action and taking the opportunity to become knowledgeable and empowered with your own health, whether that be through a combination of understanding more about health, reading, researching, becoming your own mini expert, as I often talk about, as well as perhaps doing some blood testing so that you can monitor any maybe lifestyle changes that you do and see whether your blood test results then show improvement.